we have a very special guest with us, Dr. Laurent Supit, who is a cosmetic and plastic surgeon. And then, of course, we have our senior aesthetic doctor, Dr. Yofine. Hi, Doc.
Hi.
And of course, the face that you have been seeing over and over again. I hope you're not tired of him. Our dermatologist, Dr. Maharis.
Hello.
Okay, so today's topic of discussion is actually very fun. Karena, have you guys seen the picture, actually? Have you guys seen the circulating picture recently of Demi Moore in the Fendi fashion show?
Yes. I saw the fashion show first.
Yeah.
Sampai nggak ngenalin itu Demi Moore, who opens the show.
Oh, so you actually watched the show?
Yeah, I watched the show.
It was Demi Moore, yeah.
Yeah, and I thought her face looks so weird, yeah, with the contouring or makeup gitu. Tapi sometimes kan fashion show makeupnya emang kinda different or not usual ya. I thought it's just makeup or contouring.
Yeah. That's actually my first feeling about it also. Okay, when I saw the picture, I was like, "Is this maybe kind of her transformative pictures here when she's in her 20s, 30s, 40s, 50s, and the most current one?" Okay, kita lihat semuanya shocked. So, as a plastic surgeon, what do you think went wrong here, Dr. Supit? Speechless.
All right. Yeah, I mean, Hollywood has always been able to make us speechless with their transformations and dramatic changes, right? I think it's not one. See, because we don't really see Demi Moore in her daily life. We see her when she's all made up and ready for presentation. You know, when people get old, they either get bloated and get fat, or they get really skinny and looks like a skeleton, right? I think Demi is one of those people who grows old and becomes so skinny. Like, you can see all her bones protruding, like even like in her cheek and her neck and everywhere. But they probably do a little overfill of her cheekbones.
Yes.
So that's the only thing that kind of went weird for a skeletonized older look, right?
Yes.
But I'm not sure if it's like a filler or a fat transfer.
Yeah.
But it doesn't look, I agree, it doesn't look nice, right?
Yes, especially when we're looking at the second picture. Yeah, at first we all thought it's okay, we can make up because obviously Demi Moore being in Hollywood, I'm sure she has access to the best, right? The best dermatologists, doctors, or surgeons. But I think when we're looking at the second picture, that's obviously, more than just makeup, of looking like that. What's your first impression, Dr. Ricky, when you see this picture?
When I see the image, I think her skin is saggy, and I think so. I agree with Dr. Supit that there's a hollowness on the cheeks and the overfilled of the malar region.
Yeah, and actually, I also wanted to bring up a topic that Dr. Yofine was posting on her Instagram story this morning. This hollowness on the cheeks, kind of like in banget ya, to have that kind of, that kind of look. Like even sometimes I feel like I want to have that look. And I know Dr. Supit does a lot of buccal fat removal procedure, which for those of you watching is, for those of us who want to have a more tapered look, itu bisa diambil lemaknya dari dalam ya, dari dalam mulut dipotong by a plastic surgeon, and they take out chunks of your fat out to give you that look. Do you think that plays a role in Demi Moore's transformation, Dr. Supit?
You see photos when she was in her 20s. That's kind of classic or typical for younger looking people, and also typical of Asian, actually. So specifically, I will refer to Oriental Asians who tends to have thicker cheeks, skin, right? the Caucasians and everyone actually, like babies of all races, for example, or teenagers of all race, it looks like Demi Moore in her younger age, like fuller face. And then as she grows older, this could be natural. If you look back to like the first collage that you had, the one in the red background, when she's in her like 30s and 40s, suddenly this area kind of hollows out, which in non-Oriental race, especially Caucasians, could be natural. Like it might not be any buccal thing or any lifting because they just grow like that. They grow to become bony and structurized, and suddenly they all look like Victoria's Secret models, which a lot of Asians come, again, Oriental Asians come to us, estheticians or plastic surgeons, and say, I want to have that thing there. So can you do it? And I do a lot of buccal fat removal, but if you watch closely, when I animate my face, the buccal fat will remove just this.
Okay.
So that hollowness in there, that's not only the buccal fat. There's the muscle there, there's the skin and the underlying fat there. That's kind of like the hardest part to remove, because a lot of people come for just buccal fat removal. I do it, and then they come out and say, how come I still don't look like Demi Moore? Because it's not one thing. We're thick in many layers.
So, masseter reduction, because underneath all this fat that we have, we also have a large chunk of masseter muscle, right? Which we do on a daily basis as aesthetic practitioners.
Mm-hmm.
Do you think that also plays a part in her transformation of like overdoing the masseter reduction? Because we do it all the time.
Also, I've experienced with chronic Botox injection for the masseter region. Say, for example, for the past 10 years, you keep doing it twice a year and keep injecting it. Eventually, your masseter will be hypotrophic.
Would that be the case?
It could be the case.
Yeah.
Because if you see on the second slide there, when she went that way with the shadow, it's almost like that's just bone. Like the muscle is so thin.
So atrophic, the muscle
atrophic as prolonged Botox.
Well, let's talk about the thing that we've been talking about, the elephant in the room, which is the cheek fillers. Dr. Ricky, what do you think?
I think so. I think this filler is overfilled. The cheeks is too much. She has too much filler on her cheeks. Jadi kayak ada gravitasi mendorong pipinya ke bawah ya kayaknya.
Jadi lebih berat ya malah terlihatnya wajahnya.
Berat. Dengan tidak ada support kulit yang kenceng, jadi dia turun ke bawah mengikuti gravitasi.
Also, I'm looking at her lips. When we're focusing on her lips, itu kan kayak, it's like, because Demi has always had thin lips. Even when she was younger, when she was in 20s, it was like a thin lips. Jadi as she grows older, she's not someone who's had that Hollywood housewives lips. Jadi her lips are still in normal size. Tapi the shape, it's sort of like hanging there. Do you think that could also be part of a lower facelift or a thread lift procedure, Dr. Supit?
So her lips position, I think that looking at her jawline, right? Like her skin that's there, if you see on both pictures of her on the first and second slides, there's not even the slightest bit of skin redundance. Like, even our thick Oriental skin at the age of 35 and above, you can see a little groove there because this starts to sag down. With her, it's just like a perfect line like that. There has to be something. There has to be something, unless she lives on the moon where there's zero gravity, or something is done.
Let's move on to the third slide, which is of a younger patient. Yeah, this is one of the Hadid sisters. Yeah, this is Ini siapa Dr. Yofine namanya, Gigi or Bella?
Bella,
This one is.
Bella,
Okay.
Bella Hadid,
So this one is Bella Hadid,
who
and
also present at the Fendi runway.
yeah, she was also present at the runway. And you know, I'm actually not into this Hadid sisters. I don't really follow their story. Tapi I was like looking at her, and I thought, you know, to me, she looks like someone who's a very well preserved 40s. You know, she looks like someone who looks so good in her 40s, right? In this picture. And then I was like research, and she's actually in her mid 20s.
Yes, she's younger than Gigi Hadid.
Yeah,
she's a
so
younger sister.
Yeah, and I was like quite shocked. I was surprised. Karena she also has that very gaunt look, like very, very slim look. And if you're looking at her pictures, her teenager pictures, she has that really nice, round, baby face, chubby looks. So in this case, do you think this is too much buccal fat removal or too much Botox? Or is it just, you know, she simply ages and sinks?
Aging.
What do you think, Dr. Supit?
The biggest hollowing that we see in her picture, so as I'm looking away because I look at looking at her picture, in this area, right? So and that she does hollow also a little bit on this area. So that area would probably be from the buccal fat removal. I think maybe a huge percentage of models all have had buccal fat removal because they are sort of required.
Wow. Okay.
They are sort of required to have that that hollowness, like that square thing there, right?
Yes.
But it's also contouring. Look at her makeup.
Of course.
All of this picture there had this makeup. Like I could look hollow in 10 minutes with makeup.
Of course.
Right?
Also, Dr. Ricky, what do you think of Bella Hadid?
Bella Hadid memang kelihatannya terkontur banget ya. Memang kalau jadi model, mereka lebih suka yang mukanya langsung ke kontur seperti itu supaya kelihatan bagus di foto. I think dia memang bakal fat removal pasti sih itu. Malah tapi kelihatannya jadi lebih tua ya daripada dia masih mudanya gitu, lebih seger, lebih banyak fats-nya. Tapi ya itu mungkin beauty standards-nya di Amerika seperti itu mungkin.
Jadi, let me show you the next slide. This was actually a point that Dr. Yofine made. Yeah, this is a family picture of the Hadid sisters when they were younger. And di bawah itu adalah recent picture of Bella Hadid. And on the right is her sister, her slightly older sister, Gigi Hadid, who is, that is her transformation. And Dr. Yofine was making a point this morning about how, you know, people are actually looking much younger with some fat on their cheek.
Kalau pipi full berisi itu memang kan lebih mirip ya dengan saat kita muda atau saat bayi bahkan gitu. Jadi semua bayi kan pasti mukanya full dan berisi. Jadi kalau misalnya muka yang tirus itu memang terlihatnya lebih sharp ya, lebih keren. Tapi pada umumnya membuat kita jadi jauh kelihatan lebih berusia atau lebih tua gitu sih. Jadi sebagian Asia justru suka ya muka yang berisi, muka yang berdaging, berlemak gitu, full gitu. Jadi kesannya lebih muda gitu dan juga mungkin lebih makmur ya. Biasanya itu diidentikan seperti itu.
You mean like
walaupun dengan pengaruh barat memang makin banyak mungkin generasi milenial untuk pengen mukanya lebih tirus seperti orang-orang barat gitu.
Well, let's move on to the next picture. Is Kate Moss. Kate Moss.
Oh my God, that's Kate Moss. Why does she look like that?
Sorry to disappoint you. This is Kate Moss standing next to Demi Moore. Demi Moore is in her late 50s and Kate Moss is in her late 40s. Yeah, I think Kate Moss is 47. So, yeah, what went wrong? So, you know, kalau dilihat ya memang, you know, they're very statuesque and very very model-like with the contour everywhere. Tapi, okay, what do you think, Dr. Supit? What do you think of Kate Moss look?
Are they in the they're in the same runway, right?
They're in the same runway. They're in the same Fendi runway.
So so we're positive that this is not like one of those thematic makeup thing that they have, because their cheek looks like similar.
Other models doesn't look like that kok. Kan ada banyak other, ya ada banyak model-model lain. Nggak semuanya seperti itu sih. Bahkan Naomi Campbell ya, who close the show, mukanya malah lebih berisi kayaknya dari biasanya.
Oh, I love
ada Naomi Campbell juga. Ya, mukanya tetap berisi. Dia nggak jadi seperti yang foto-foto sebelumnya kita share itu.
I don't think with Kate Moss case, I don't think it's only buccal fat removal. She doesn't have any buccal fat remaining.
At the first
so that's probably removed sometime along the way. Something like all along her masseter area, it's also atrophied. But her cheek, I don't think her cheek is wrong. Like her upper cheek or the zygomatic maxillary area, they're not off. This area are off. If you fill them just to balance the cheek, I think she's gonna look young again. She can come to me for fillers. Oh, you guys.
We can save her, yeah. We can save her.
We can save her.
How would you treat her face, Dr. Ricky? Kate Moss.
Tambahin filler yang banyak.
Tambahin filler yang banyak.
Dan skin booster juga itu sekitar daerah bibirnya kendor banget ya kulitnya ya.
Yeah, she has a very deep melanite line in all her other pictures. I was researching, looking at her other pictures. She had that, that very, very active DAO. Jadi the depressor muscles are very,
Sama di top match nih ya, bagus.
Yes, I agree. So we can still save this face, yeah, actually, theoretically speaking.
Hey, I can save Demi more too. Or if I can't, she can still come to me.
Of final words of advice to our friends watching, the beauty lovers, how would you advise them to approach their anti-aging program, their face treatment?
Good look doesn't necessarily mean you have to have sharp edges, but I think there's two kind of cakep. Keren itu, keren itu can be men or women, right? Atau yang cute. Some people think keren is everything. Some people I choose, for me, I choose cute. Cute is everlasting. Everyone loves babies and puppies, and cute is lovely too. But we are here, each one of us, aestheticians and plastic surgeons, to help patients transform to what
karena
they
kita
like.
tahu ya kan proses aging itu fat akan berkurang gitu. Jadi sebenarnya kan kita di sini untuk supaya pasien dapat memutuskan lebih baik untuk dirinya ya, walaupun selera memang beda-beda seperti yang Dr. Supit bilang. Ada yang suka cute, ada yang suka tirus gitu. Tapi kita beritahu bahwa seiring usia fat ini bisa jadi kamu butuhkan untuk terlihat lebih muda dan untuk support supaya kulitnya tidak terlalu sagging gitu. Jadi mungkin ada baiknya jika ingin mengurangi fat gitu, tidak seluruhnya dihilangkan atau tidak sampai tirus banget gitu. Kalau ingin supaya nanti tuanya tidak harus filler terlalu banyak untuk menggantikan fat yang hilang. Jadi edukasi ya, kita kasih tahu bahwa akibatnya seperti ini, kira-kira masih ingin diteruskan dan seberapa banyak ekspektasinya untuk bisa terlihat lebih ramping atau lebih tirus pipinya.
Aku lumayan setuju dengan Dr. Supit bilang tadi mengenai it's preference. Tiap orang mempunyai preference masing-masing. Ada yang lebih suka cute, ada yang lebih suka lebih sharp. Intinya sih jangan terlalu ikutin beauty standard di luar negeri karena belum tentu juga cocok sama muka kita juga kayak gitu. Dan Mungkin yang sekarang hollow, nanti nggak taunya berapa tahun lagi trennya adalah chubby, beda lagi gitu.
Especially with the Korean pop coming, that's gonna bring more Oriental fever.
Betul.
Yes.
Ya. Sama seperti rambut atau sulam alis ataupun cara makeup itu kan selalu berubah dan ever changing. And kalau misalnya surgery kan it's quite permanent. So you might regret it later kalau misalnya terlalu terburu-buru atau tergesa-gesa merubah-rubah muka.
Thank you everyone for sharing. Thank you,
Thank
Dr.
you,
Supit. Thank you,
Edrican.
Dr. Yofine.
Thank you. Bye-bye.
Bye.